Hello everyone. Am I audible and visible? Let me know. Let me know, then we'll start. Audible and visible? Okay. Fine. Hello everyone. On this YouTube platform, Unacademy Future Doctors, we are posting videos for MBBS students. So if you have anyone who has completed NEET UG and waiting for the admission for MBBS, physiotherapy, nursing, dental and homeopathy, these all videos, they are very important for those students. So please share this video to those students and ask them to watch our videos and subscribe our channel, that is Unacademy Future Doctors. Okay, now let me start. I myself, Dr.Dipti. I am MD PhD Physiology and I'm Associate Professor educating MBBS, nursing, physiotherapy, dental and MD students. Okay, and I have more than 17 years of teaching experience. Now let me explain in brief about our subscription. We have two kinds of subscription. One that is plus subscription. Here you can choose the best from two of the best. You can access live and recorded classes here. You can study on the device of your choice. You can learn from India's top educators for your medical exams. You can access question bank. Our question bank is having more than 25,000 questions. You can compete in the live test as well as quizzes. And within 12 months and above subscription, we are providing printed notes too. Second is our iconic subscription. Here your access to the best from two of the best. And these two are, one is Unacademy and Prep Ladder. With Unacademy, all the features I have explained, and second one that is Unacademy and Prep Ladder. With Prep Ladder, here you can have clinical and integrated essential video lectures from the Dream Team, Question Bank 3 with active guidance, system tags and more, rapid revision and snapshots, treasures and 2021 Dream Notes. Now, in our special class, we have added the feature, that is we have made the class interactive. You can have facility of raise a hand. You can poll for the learners. You can never miss a class as you are always notified for your class. And you can download lecture notes and get access to the recorded sessions. You can access the class anytime and at anywhere. As well as we also have upgraded and highly effective question bank, which is having more than 25,000 high yield clinical questions. These are based on latest exam pattern, and along with that we have detailed explanation too. These are our NEET PG 2021 toppers. Also we have test rituals here. These are various test rituals, free as well as plus batch test rituals are there. Also, we have started Focus FMGE 2022 comprehensive batch from 15 December 2021, that is for 6 months, and second, that is Target NEET PG 2022 test and discussion batch, that is from 15th December, and that is for 3 months. You can subscribe, you can use my code Dipti10, and you can, here we have extended this policy for the subscription. You can get 22% discount up to 5th of January if you use my code Dipti10. Okay, now let us start with our today's topic. Today we'll discuss about functional anatomy of skeletal muscle. Okay, so now, as we all know, skeletal muscle, we have discussed muscle is a tissue, and we have skeletal muscle, cardiac muscle, and we also have smooth muscles. Okay, so skeletal muscle, like nerves, they are excitable tissue. Okay, so excitable tissue means when we stimulate this tissue, it produces response, that is in the form of contraction. So when skeletal muscle is stimulated, excited, then there is contraction. Okay, next, the name suggests skeleton. They are attached to bones, attached to skeleton. You can see here in this diagram, this is skeletal muscle. Okay, now here we have about 40% of total body mass that consists of skeletal muscle. Okay, now And another thing, what is the important function of skeletal muscle? That is, the name itself suggests, as they are attached with the bones, they are important for the movement of the bone. These skeletal muscles, they are non-syncytial muscle. Non-syncytial means they don't act as single unit. Okay, they don't act as single unit. Non-syncytial muscles. Okay, they don't have anatomical and physiological connections. There is no anatomical and physiological connection between different muscle fibers. You can see here, all are different. Okay, so this is about some features of skeletal muscle. Now, this muscle fibers, skeletal muscle fibers, they have connective tissue framework. Okay, so this connective tissue framework, you can see here, these are different muscle fibers. Muscle fiber is equal to muscle cell. Okay, so this muscle fibers, they are surrounded by connective tissues. Okay, so this connective tissues are in different layers, different ways, and that forms three things. One, that is endomysium, second is perimysium, and third is epimysium. What are these three? Now, endomysium, that is a delicate connective tissue covering, you can see here, that is surrounding each muscle cell. This one, endomysium. Okay, and here this muscle fibers, they are in bundles. This muscle fibers are in bundles. Okay, you can see here this way. These bundles are known as fascicles. Fascicles. So these bundles or fascicles are there, and around Yuvraj Chaudhary, you are late today. Why is it so? Welcome to the class. Ask your friends also. They are watching videos, but not in the live class. Most of them are, because at the end of the day, around 60, 70, 80 people viewed the video, but not in live class. Okay, so ask them to join. Okay, it's fine. So now here you can see, so endomysium, you can see this is a connective tissue covering which covers single muscle fiber. You can see muscle fiber or muscle cell here. Okay, then this is a bundle, you can see covering each bundle. You can see here, this is connective tissue, that is perimysium, this one covering one bundle here. Okay, and all these fascicles, they are covered by another connective tissue covering, that is known as epimysium. Just a minute, I have some connective issue. So this is epimysium, the whole which covers Yuvraj. Okay, this is epimysium. You can see here this one, epimysium, which covers all the bundles. Okay, so all these are connective tissue covering. Now, what is the use of this covering, connective tissue covering? You can see this separate this fibers within. Okay, and second thing, they carry, you can see blood vessels here, they're carried out along with them. Okay, so this is the structure. Now another thing here is, there is a tendon. What is tendon? You can see here, this is muscle, this is tendon. So tendon, they are fibrous terminal ends of the muscle, and these are made up of collagen fiber. Another important thing, Yuvraj, are you there? You yesterday asked me about anatomy classes. Anatomy classes will be started soon. Okay, within this month only. So you are, and another important thing, you ask your other friends to join, because of this COVID situation, I think your classes will not be conducted offline. Probably classes will be online only. So please ask your other friends to start their studies. That will be benefited. Okay. And about anatomy classes will be, I talked with the authority. They told me that classes will be started within a week, in this week. Okay, madam is little bit busy, so she couldn't start the class, so they'll be started, she will be starting the classes. Okay. So now here you can see tendon. This is tendon. This one, what is tendon? Fibrous terminal end of the muscle, and that is made up of collagen fibers. Okay, now next is, you can see here, at the junction of muscle with the tendon, here you can see all this epimysium, endomysium, perimysium, they all become continuous and they form tendon. You can see here this one. Okay, now So tendon, as I told you, that is fibrous terminal end of the muscle. Okay, and this through tendon, muscle is attached to bone. You will taught all those things in your anatomy, tendon, fiber. Okay, and another terminology here, that is aponeurosis. When this tendon is thin, flat and stretched, that is known as aponeurosis. Okay, thin, flat and stretched one. Okay, now we will discuss about structure of muscle fiber. Very important thing here, muscle fiber. You come across this terminology. Muscle fiber is nothing but a muscle cell. You can see here, this is one fiber. It is about, what is the normal length of muscle fiber? That is 1 to 40 nanometer. Sorry, millimeter. Sorry, 1 to 40 millimeter, or okay, 4 centimeter. And it is cylindrical in shape. So cylinder, it is like this cylinder. So 1 to 40 millimeter length, and diameter here, this is the diameter, that is 10 to 100 micron or micrometer. And it is multinucleated cell. You can see it is one of the cell, only cell in our body which has multiple nuclei in single cell. Okay, shape, as I told you, cylindrical. Okay, then certain terminologies here. Sarcolemma. What is sarcolemma? This is, you can see, cell membrane of skeletal muscle cell, that is known as sarcolemma. Okay, then sarcoplasm. What is sarcoplasm? That is cytoplasm. Here inside the cell there is cytoplasm of skeletal muscle cell, that is sarcoplasm. Then they have myofibrils. Myofibrils means this cells, they have fibrils. Here you can see, these are here, this is one myofibril, this one. So these are myofibril. Okay, also along with that, cell is having all the other organelle like other cells like mitochondria, Golgi apparatus, sarcoplasmic reticulum. Sarcoplasmic reticulum is smooth endoplasmic reticulum of skeletal muscle cell. Endoplasmic reticulum. Okay, also it has glycogen, ribosomes, lipid droplets and all. Okay, now structure, as I told you, all the organelle, nuclei, myofibrils. Okay, Golgi apparatus, mitochondria, sarcoplasmic reticulum, ribosomes, glycogen and lipid droplets are present. Okay, now terminologies, as I told you, myocyte. Myocyte is skeletal muscle cell. Okay, skeletal muscle cell. Sarcolemma, that is skeletal muscle cell membrane, that is sarcolemma. Third, sarcoplasm, skeletal muscle cytoplasm, cytoplasm of skeletal muscle cell. Sarcoplasmic reticulum, that is endoplasmic reticulum of skeletal muscle cell. Okay, so these are the terminologies. Now next is nuclei. You can see, as I told you, nuclei are one or many. Shape of the nucleus is either it is oval or elongated shape. Okay, and it is located beneath the sarcolemma. You can see this is the cell membrane. Just beneath the cell membrane there is nucleus, this one. Okay, now next is myofibrils. Okay, so each muscle fiber has got, you can see, this is one myofibril. Large number of myofibrils are present in the muscle cell. Okay, and these myofibrils, they run parallel to each other. Okay, this myofibril, the length of myofibril, that is 1 to 2 micrometer. Okay, and the diameter is 1 to 2 micrometer, and the length is 1 to 40 millimeter, like the length of your skeletal muscle cell. 1 to 40 millimeter is the length, and diameter 1 to 2 micrometer. Okay. Now, this myofibril, it consists of thin and thick filaments. You can see here, this is your thin filament actin, and these are your thick filament myosin. Okay, so it consists of thick and thin filaments. Okay. Now, number of thick and thin filaments are double, 3000, and thick filaments are 1500. Okay, they are double in number, thin filaments. Okay, and the arrangement is in such a way that it produces striations. You can see here striations, and therefore the muscle cell, skeletal muscle cell, is known as striated muscle. Okay, now striations, as you can see here, this gives striations like dark and light color. Okay, so this dark band, which is also known as A band. Why A band? Because it is anisotropic to polarized light. What is isotropic and anisotropic to polarized light? Isotropic means when polarized light passes, okay, on that particular area, what happens? Light rays are refracted at the same angle. Okay, and when they are refracted at the same angle, the band is, it looks lighter. Whereas in A band, when light rays they fall, they are refracted in different angles and it gives dark color. Okay, so this is A and I band. A band is anisotropic to polarized light. Length is 1 point. You can see this is your A band, this one, which is having thick filament, this one. Length is 1.5 micrometer. Okay, in the center here there is H zone. You can see this one, central part, which is also known as Hansen zone. Okay, Hansen or the hell, which is in German, the name is light, meaning is light. Okay, so this is H zone, this is your A band. Okay, now next is in the center of H zone, you can see here there is M line here. You can see here this one, M line. Then H zone here. H zone, why H zone? Because it doesn't have myosin heads. You can see here. Suppose this is A band. Okay, A band has got myosin heads here like this. But in the center part, myosin heads are absent. So it is quite lighter. It gives H zone. Okay, and in the center there is M line. Okay, and what is I band? You can see here. This is lighter one. This is known as I band because it is isotropic to polarized light. Means when polarized light passes, then it is refracted in one direction only. Okay, so this is I band. And in the center of the I band, you can see there is Z line. Is Z line or Z disc? Western Z. And the meaning, German meaning is between disc. Okay, now, so microscopically, as we have seen, there are two bands. You can see here, this is dark band, A band, and light band. And in the center of light band, there is Z disc. Dark band, that is 1.5 micrometer length. This is the length of dark band. And light band, that is 1 micrometer. Okay, so 1 micrometer in this, you can see, suppose this is A band and this is I. Okay, this is 1.5 and this is 1. In the center of this 1, we have Z disc. Okay, this side also, this is light in the center. So you can see what is the length becomes here, 1.5 plus 0.5 plus 0.5. So the length would be 2.5 micrometer. That is the length of sarcomere. What is sarcomere? I think all of you are knowing. It is the distance between two Z disc. Okay, this is sarcomere. Now, structure of muscle. As I told you, sarcomere. What is sarcomere? It is the distance between two Z line. You can see here, this is one Z line, this is another. In between, that is sarcomere. So sarcomere has a band. You can see here, this is, in this also you can see, this is one Z line, this is another, okay, and it has got in the center a band, this one, okay, and half of the I band, both the sides, okay. So A band plus half I band plus half I band, okay. So this is 2.5 micrometer A band, this is 0.5 and this is 0.5. So the total is, sorry, this is 1.5, 0.5, 0.5. So the total would be 2.5 micrometer is the length of sarcomere, okay, in the resting condition. Another important thing, sarcomere is known as structural and functional unit of muscle fiber. Like cell is the structural and functional unit, same way sarcomere is structural and functional unit of the muscle fiber, okay. Now during muscle contraction, when muscle contracts, sarcomere length decreases, okay. The length is, least length would be when you can see here, this is A band 1.5, you can see here, and when this sarcomere is contracted, there is complete overlapping of A band and I band. So I band is on the A band, so you can see here there is no I band, you can see here. So what would be the length? 1.5 micrometer, that is the length of A band, okay. So what is the length of sarcomere? When muscle gets contracted, it is 1.5 micrometer, and when muscle is completely relaxed, you can see here that this would be 1.5 plus 1 plus 1, so it would be 3.5 micrometer, complete relaxation, because all the this actin filaments get separated, okay. So this is the length of sarcomere. So this we have discussed. I have given some idea about the structure of skeletal muscle, okay, functional anatomy. We will discuss in detail about sarcomere in tomorrow's class. Today we will discuss another topic that is also very important one, that is Sarco-tubular system. Okay, now what is the Sarco-tubular system? The name itself suggests sarcoplasmic reticulum and T-tubules. Okay, so they both form a specialized system, and this specialized system, what is its function? It functions to transmit action potential, and as action potential is transmitted, that results in contraction. So excitation and contraction, that is for that we have an important structure, sarco-tubular system. Okay, so it consists of two things. Number one is sarcoplasmic reticulum. What is sarcoplasmic reticulum? We have discussed, that is endoplasmic reticulum of skeletal muscle cell, that is sarcoplasmic reticulum. And second is T-tubule. You can see here, this is like this, but normal skeletal muscle cell is like cylinder like this. So T-tubule is like this, transversely running, okay. This is T-tubule, okay. These are highly specialized system, as I told you, that play an important role in the conduction of the wave of depolarization. Whenever, as we have discussed in the neuromuscular junction, when action potential reaches to the sarcolemma. What is sarcolemma? Cell membrane of the skeletal muscle. Then it immediately enters here inside the T-tubule. So it gets conducted, okay. Now this is the role, you can see here. This is again, you can see, as I told you, these T-tubules are like this, transversely running. These T-tubules, they are the invagination of sarcolemma. Suppose you can see, this is cell membrane, so this invaginate like this, and it forms T-tubule. Here also it forms T-tubule like this, okay. So what happens? Action potential passes here inside, okay. Now, so T-tubules, as I told you, it is present through and through, and it is the Nikita Soni What happens? दोबारा explain कीजिए. What Nikita, let me know what didn't you understand? Sarco-tubular system or something else? Let me know, I'll explain again. No issues. Sarco-tubular system, should I explain? Let me know, please. Nikita? Okay. So, you can see here. I'll explain you again for all. You can see here, this is skeletal muscle cell. You can, okay. So, this skeletal muscle cell has a system that is sarco-tubular system. Sarco-tubular, sarcoplasmic reticulum. What is sarcoplasmic reticulum? That is endoplasmic reticulum of skeletal muscle cell. Okay. So this is, you can see, this one is sarcoplasmic reticulum. You can see here. This is not very nicely seen. In the other diagram, I could show you. You can see here. This one, yellow colored one. This is sarcoplasmic reticulum. Okay. And this is T-tubule. What is T-tubule? It is nothing but, you can see, suppose this is your skeletal muscle cell. So cell membrane, it is like this, invaginated. This is T-tubule. Okay, actually the cell is not like this, it is like this, as I told you, like this way. So these T-tubules are like this one. Am I clear? So this is the invagination of sarcolemma. And along with that, you can see this is T-tubule and this is sarcoplasmic reticulum here. Am I clear? These two, they form one important system. How is it important? We will discuss. This is sarco-tubular system. At present, you remember only this thing. Two things are there in sarco-tubular system. Sarcoplasmic reticulum and T-tubule. Now, what is the role that I'll explain you? Then you can understand nicely. Okay? Now, so here you can see, as I told you, please first listen this thing. I will teach everything. What happens and how this action potential is transmitted. Okay? So, here you can see, this is your T-tubule, as I told you, like this. Okay. So it is invagination of sarcolemma. So it contains which fluid? Extracellular fluid. So whenever your action potential comes here, it will enter inside the cell through this T-tubule. Okay. Now, this T-tubule, again, this is again the diagram of T-tubule. This T-tubule has very important receptors, DHP receptor. Sometimes this may be asked as a short question. Name of the receptor is dihydropyridine receptor. Why dihydropyridine? Because these are blocked by the drug dihydropyridine. So they are known as dihydropyridine receptors. Okay. Now, this dihydropyridine receptors, these are voltage gated calcium channels. So whenever action potential comes and voltage changes, these calcium channels, they open. Okay. Okay. And once they get open, now they activate longitudinal tubule. Longitudinal tubule, which is also known as sarcoplasmic reticulum. Why longitudinal? Because they are, you can see here, this is transverse tubule. Okay. Am I clear, Nikita? So it has, this is longitudinally. Is it? So this is longitudinal tubule. Okay. Now, so here, this sarcoplasmic reticulum, which is known as longitudinal tubule, it has another receptors known as ryanodine receptor. Okay, ryanodine receptors. These are also calcium channels. Okay, again you can see. Now, so this longitudinal tubules, they have ryanodine receptors, and this another important thing which I have forgotten. First of all, before going in detail of that, we will discuss another structure. Here you can see, this is your T tubule and these are your L tubules. Okay, and at the terminal part of this L tubule, it forms like this, which is known as terminal cistern. So it is like elevated part, that is terminal cistern. Okay. Now, so this terminal cistern, what is the importance of terminal cistern? It has got large amount of calcium storage. and glycogen is also there. Now, what is the role of calcium? Calcium is required for muscle contraction. How? As all of you are knowing, troponin T, troponin C and troponin I. So when to troponin C calcium ions binds, then only there is muscle contraction. So for that also we require calcium ions. Okay. And this calcium ions, they enter. For that we have another receptors. These are known as ryanodine receptor. You can see here. So this is dihydropyridine receptor. This one dihydropyridine receptor कहाँ पे है? T tubules पे. And ryanodine receptors कहाँ पे है? Terminal cistern पे. Okay. So here also they increase entry of calcium ions in the sarcoplasm. Why calcium ions are required? As I told you, we have actin and myosin filaments here. Okay. And to the actin filament, we have troponin I, troponin T and troponin C. And when calcium ion binds with the troponin C, then only troponin tropomyosin complex is removed. We will discuss all these things, and that is required for muscle contraction. We will discuss all these things with muscle contraction. Okay. So, but at present you remember this calcium ions, they enter or they come out of this sarcoplasmic reticulum. For that we have receptors. These are ryanodine receptors. Okay. Now, why are they known as ryanodine receptors? Because they kept open by ryanodine. Okay. So this is about ryanodine receptors. Another important thing here is there is triad. What is triad? Triad means you can see here. There is here you can see T tubule, this one. Okay. Through and through invagination. This way. Transverse tubule. Okay. And you can see here this is sarcoplasmic reticulum. Terminally, it has this kind of terminal cistern. Okay. This side also, this is terminal cistern. So, you can see here, this is known as triad. Triad means one T tubule and two terminal cistern, three things. And these triads are present at AI junction. AI junction means junction of the, you can see here, A band and I band here. So you can see here and at this way. Okay, and there are two AI junction in one sarcomere in skeletal muscle. So in skeletal muscle, how many triads are there per sarcomere? Two AI junction. So always definitely two triads. Okay, am I clear? So this is, I'll show you. You can see here. You can see here. These are present at AI junction. This is A and I. Here we have triad. Okay. So this is the thing which is important. Sarco-tubular system. Am I clear? Nikita and Yuvraj and all other those who are available. Let me know if any doubt. Okay. So now today's revision questions. Okay. Let us explain questions. Some of the questions I have prepared from today's topic. There one is skeletal muscle constitute how much body mass? We have discussed 40% of body mass, total body mass, that is by skeletal muscle. Okay. Now what is endomysium? What is perimysium and epimysium? Endomysium, as I told you, which covers single skeletal muscle fiber, that is endomysium. There are bundles. Perimysium is the connective tissue covering which covers one bundle. Okay. And epimysium is a connective tissue covering that covers all the bundles here. This one. Okay. Now, next question. What is tendon? What is tendon? Tendon, that is fibrous terminal end of the muscle, and this tendon consists of collagen fibers. Okay. What is the length and shape of muscle fiber? Shape, as I told you, cylindrical shape. Okay. Length is 1 to 40 millimeter. Okay. And diameter is 10 to 100 micron. Okay. Now, What is sarcolemma? As I told you, sarcolemma is the cell membrane of skeletal muscle cell, and sarcoplasm is the cytoplasm of skeletal muscle cell. Okay, then which organelle are present in the skeletal muscle cell? All the organelle of the cell, they are carried out by skeletal muscle cell, and they are the nuclei, Golgi apparatus, mitochondria, sarcoplasmic reticulum, ribosomes, lipid granules, glycogen, all are present in the skeletal muscle cell. Okay, then you can write these questions also. Small questions, short questions are very important. Okay, what are myofibrils? Myofibrils. In each skeletal muscle fiber, there are large number of myofibrils which are present, and they are running parallel to the skeletal muscle fiber through the entire length of the skeletal muscle fiber. Okay, this myofibril also having length similar to skeletal muscle fiber, that is 1 to 40 millimeter, and diameter is here still less. One cell is having 10 to 100 micron diameter. One fibril is having 1 to 2 micrometer diameter. Okay. Okay. And because of the arrangement of myofibrils, there is dark and light bands, A and I bands. Okay. They are present. That is, striations are present. Okay. Now, what is A band? As I told you, A band is anisotropic to polarized light. Anisotropic means when light rays they fall, they are refracted in all the directions, so it gives dark color, and it is because of myosin filaments. And actin are also there, but mainly myosin filaments, they give dark color, A band. Then what is H zone? Hansen's zone. In the center of A zone, you can see A band. This is A band. In the center, it is quite light. That is H, Hansen's zone. Okay, this is H zone that is present in the center. Okay, what is M line? In the center of H zone, there is one line, and this is known as M line, and this becomes more pronounced or more prominent during muscle contraction. Okay, this is M line. Now, what is I band? I band, that is isotropic to polarized light. Here you can see this is A band, and on both the sides there are I band. Okay, and length is 1 micrometer. Length of A band, that is 1.5 micrometer. Okay, and in the center of I band there is Z disc. Okay, next is describe in brief about sarcomere. Sarcomere, that is part between two Z disc, and that is structural and functional unit of the skeletal muscle fiber. Okay, now next is, as I told you, what is Sarco-tubular system? That is sarcoplasmic reticulum and T-tubule. Between them there is both of them, they form Sarco-tubular system. Okay, this is Sarco-tubular. And that, what is the role, important role of Sarco-tubular system? That it is specialized system for the conduction of action potential and muscle contraction. Okay, what is the role of dihydropyridine receptors? As I told you, dihydropyridine receptors, they are present in the transverse tubule. These are voltage gated calcium channels. Okay, voltage gated calcium channels. And why are they known as dihydropyridine receptor? Because they are blocked by the drug dihydropyridine. Okay, and when action potential enters here, there is opening of this channel. Okay, then next is, what is the role of sarcoplasmic reticulum? You can see here there is terminal cistern and sarcoplasmic reticulum, which has storage of calcium ions and storage of glycogen. So here you can see this glycogen and this calcium ions, they are available at the time of muscle contraction. And channels here, these are ryanodine receptor. Why are they known as ryanodine receptors? Because they are kept open by the drug ryanodine. Okay, now next is, What is triad? Triad means, as I told you, made up of one T-tubule and two terminal cisterns. And this triad is present at the junction of A band and I band. Here is one triad, here is another triad. So you can see in sarcomere there are two triads as they are present at the junction of A band and I band here. Okay, so this is all about today's topic. If you have any doubt, you can put your doubt in the comment box. If you like my video, you can like it, you can share with all your friends, those who are waiting for the admission. As I told you in the beginning that these videos are very important for NEET, UG crackers, those who are waiting for the admission in MBBS, nursing, physiotherapy, dental and homeopathy. So please share this video to all your friends, those who are waiting for the admission. Okay, and you can subscribe our channel on Unacademy Future Doctors. Thank you.